It is so great to see you all and to feel the energy from your college. It's even though we're virtual, I can tell from here that you are all happy to see each other and engage. So it's exciting to have that opportunity. This is an opportunity for you to ask us questions about things that are on your mind. I have just a couple of introductory remarks, and then I'm going to have Rex Force give us a little bit of a health update. He's joining us, and then we'll move forward with just a really short agenda, and then your questions. Before we get started with that, I want to start by thanking Scott Rasmussen, my co-host. I believe he is with us. Are you with us, Scott?
Yes, I am.
Good to see you. And then also big shout out to Marketing and Communications for their support of this event, and Ginny Larimore in particular, who's going to be our moderator. And when we get to the questions period, she will tell us how that works. And I will turn it over to her at that time. I wanted to just make a couple of remarks about really the heavy lift that I know all of you in the College of Technology have put into place in the last couple of weeks. Of all of the colleges, there is no college more impacted by yours. And I want you to know that I know that. And while I am a historian and haven't taught in the kind of face-to-face, hands-on environments that you operate in every day, I do know that the impact to you has been greatest on campus. And the things that you've had to do to address this need to be in a distance environment has been the most disruptive to you and to your students. So I am grateful to everything that you've done, and we are poised in the Office of the Provost to make some adjustments and in-course corrections to help you and your students meet the criteria for graduation and to complete their certificates. I'm happy to answer questions about that, but I just wanted you to know that I am aware of how difficult this has been, how disruptive it's been, and how stressful it is. And my heart goes out to you all, and I'm super appreciative of the hard work you've done. On that note, we are in an unprecedented time, as you all know. There is no other historical period that comes up to this in the last 100 years, other than the World War II era, in which a lot of American citizens had to sequester themselves because they couldn't travel, because there was rationing of goods and services, because their lives were disrupted by the war effort, because they had a lot of concern, of course, about their sons and husbands who were fighting on the front. Certainly in Europe, there was more disruption than there was here, since the battlefields were not on our soil. But the only other time period in the last 100 years that even comes close to this would be that World War II period. Certainly we could talk about the Spanish flu, but the world was very different in 1918 than it is today. So that's not even as good of a comparison, probably. So I bring that up because, of course, I'm a historian, but also because I think it helps us understand that the anxiety that we have now, that the tension that we feel that we don't understand, that the daily weight of this time period, while it is not a normal time for anyone, those reactions are normal. We know from history that people who have experienced this kind of traumatic episode have exhibited the same kinds of things that we all see. And that we're all feeling on a daily basis. Sometimes sometimes we're okay, and then an hour later you can feel just devastated. That is difficult to manage, but I can assure you that other historical time periods tell us that that is, in these situations, not abnormal. So it's not you. It's the situation that we are in, and we are in it together. and I'm here to provide all the support that I can from my office, which is still functioning. We're just all in our homes doing that work. But I want you to know that we are here for you, and that if you are feeling anxious, that is a normal situation right now. And with that, I'm going to turn it over to Rex, who, if he's here, Rex Force, are you with us?
Yep, I'm here, Laura.
Just to give us a little bit of an update on where we are. I know some of you have a lot of questions about whether or not you're going to be able to get back into your labs in that second summer session, what you're going to do with these face-to-face courses in the fall. And Rex is going to give us just a little bit of an update on where we are on the health front. Thanks, Rex.
Sure. Yeah, and unfortunately, I don't have a crystal ball, which is really what I think most people are interested in at this point. How are we going to get back to a sense of normalcy? I don't know, Laura, do you want me to hand it over to Ginny real quick just to talk about a Q&A process so that if people want to ask questions either of me or of you moving forward, that we have sort of that process outlined for them?
That's a good idea because you may get a few questions before you have to sign off.
Yeah, that's what I was
good
thinking.
Idea.
Too. Yeah. Ginny, if you're here, do you want to just talk with the group about process? And then I'm happy to answer questions either as people chime in or if they want to shoot them through to you via the chat feature.
Absolutely. So if everybody would hover over their video and look down at the bottom icons, you'll see a feature called chat. And once you click on that, your chat feature will open up to the right. The first thing you'll see at the very bottom right of your screen is a little blue drop down that says everyone. So if you type anything in there right now, it will go to every single person who's in this Zoom meeting right now. And if you want to submit a question, I would suggest that you either do it to everyone, or if you'd like to send it just to me, that's anonymous, and I will ask the question anonymously. So what you'll do is hit that drop down button and then find my name, Ginny Larimore, and then when you do that, once you pull my name up, it should have a red parentheses with the word privately beside it after my name. And so once you see that, you know you're safe to just type to me, and then I'll ask the questions in order that they are asked. And let me know if you have any questions either now or as we go. And one last note, the session here is being recorded, and all of our town hall meetings will be archived and placed on isu.edu/townhall. So you can go back or send this this recording to anyone who was not able to come today. Thanks for having me, everybody.
Thanks, Ginny. So those of you who don't know me, I'm Rex Force. I'm Vice President for Health Sciences, and I work closely with Provost Woodworth Nye in the Office of Academic Affairs. I've been helping to kind of coordinate the, I guess, medical and public health response and activities related to COVID and the impacts that it has had on our campus. So I've been trying to stay fairly engaged in, I guess, the latest as it comes from the health department and from the state. As you're probably aware, we haven't had a tremendous number of cases in Southeast Idaho of the COVID-19. We've had 8 cases at last count in Bannock County, and a handful more than that in our public health district, which is an 8-county area here in Southeast Idaho. Had a few more cases up in Bonneville County than we have here. Overall, across the state, there's over 1,700 cases, and there have been well over 50 deaths due to the coronavirus infection. This is a virus that appears to affect people with certain risk factors to a greater extent. That is, those folks that have chronic health conditions and the elderly. It seems to cause more problems in folks with heart disease, lung disease, obesity, diabetes, and other conditions that could affect the immune system or affect how well people breathe. And it seems to be less severe in children, as many of you have probably, I mean, it's hard to not have picked up at least some knowledge on this particular illness Um, and so you may know some of these basic issues. The biggest question that we're up against right now is, well, where are we on this curve in the state of Idaho and even in Southeast Idaho? And how close are we to be able to go back to work in a regular way? Because of the nature of how this infectious disease infects people, incubates and then infects people, and causes illness over time, what we end up seeing is that it's usually about a 2-week course of illness for many people that are infected. And so because of that long course of illness, that requires us to have a longer period of time of isolation, not only of the people that have the illness, but keeping them from infecting others. And so it takes quite a bit of time for these distancing measures that we're having right now to kind of snuff out the illness in the population. We are seeing the effects of that statewide. We've been seeing declines in the daily cases fairly regularly over the past couple of weeks. And as you know, we have a governor's stay-at-home order in place until the end of the month, at which point things will be reevaluated. Even when they're reevaluated at that time, I would say that it's unlikely that we will go back to normal operations very quickly after that. One of the biggest concerns is that if we relax some of these social distancing measures and other disease mitigation measures, that we will see a blooming or a blossoming of infection. That's happened in many situations as some of these measures have been relaxed. So what I expect us to have happen, not only here at ISU, and we're working on a plan for going back to work and reopening, but also in our greater community, is that we'll have sort of a staged reopening. That is, different phases of reopening and limiting of the social distancing. That is, moving towards allowing larger groups or different kinds of businesses to open or those kinds of things. But it will take a bit of time for all of that to play out, a matter of weeks. Some of the public health guidance that we've been looking at is that even when we are truly flattening the curve and we're really sort of on top of this, it still could be another 8 to 16 weeks of gradual relaxing of some of these disease mitigation efforts before we're back to normal, so to speak. The other thing that's very possible is that this illness may become a part of kind of our the natural history, if you will, of our communities. Much like the flu, we have bad years of influenza and better years, and it's possible that coronavirus, COVID-19, could become seasonal, could be a part of what we do moving forward, which is one of the reasons why efforts towards developing a vaccine or other treatment measures are really, really important at this time. Because if we can develop vaccination, then we can limit the spread and limit the ongoing mitigation efforts that are necessary to control the illness. This is an illness that is much more severe than influenza. We do have deaths every year from the flu, but the death rate for coronavirus is quite a bit higher than it is for influenza, probably 10 times higher, if not even more than that. So this is a more severe illness than the typical influenza that occurs. So all those things put together means that we still have a process that will last well into the summer, even under the best of circumstances, in terms of relaxing the mitigation efforts that we have ongoing at this time. And so I don't anticipate us moving towards having in-person classes before midsummer at the earliest. And the provost and I have spoken about how we might roll these changes out over time. But it's difficult to see, and if we have an increase in cases in the state of Idaho or in our region, it obviously could change our plans in a very short period of time. I'm going to pause there, and if people have questions about sort of the the medical response or the public health response that the university's been engaged with, they're welcome to ask questions or shoot questions through to Ginny and she can read them to us. Otherwise, I can hand it back to Laura.
Rex, you mentioned midsummer for any possibility of coming back to campus. Can you address the possibility of students who could get into the clinical setting this summer? Would the university allow this if things are looking better?
So I think that's a really good question, and we have a sort of a work group that is coming together this week to talk about reopening. And when we talk about reopening, it's everything from clinical placements, being able to work in larger groups, and even face-to-face education. I think that there is a possibility later in the summer for some of the clinical activities to begin again. I think in some of the disciplines, we may have to take them on a discipline by discipline or case by case basis. We know in the health sciences, for example, that some of our partners where our students train, that they have had a 90-day moratorium on clinical training. And so it is going to be a complicated and potentially individualized approach, maybe even down to the student level in some cases, to be able to get students back into clinical training settings. So it's going to be a difficult thing to work out, but I do think there are some opportunities as we get towards the middle of summer. And when I say that, I'm talking June, July timeframe, that we may be able to have more clinical training or more hands-on kinds of activities with our students.
Okay, and we have a question. What is happening with the items we gave for the surplus? Will those items be returned if unused or reimbursed to departments to replenish our supplies?
So that's a really good question. We did put out a call for personal protective equipment, masks, gloves, gowns, those kinds of things. There is an inventory of those that has been collected. The idea is that there will be a, protocol developed for the distribution of, the distribution of that equipment, either to community need or to our own university need. We haven't had to dip into that supply yet because fortunately we haven't had a ton of illness so far in the community or on campus. Those items, as I said, have been inventoried. So if your department gave, say, 100 masks and 10 gowns, we know that. Those items if this goes away, those items will be returned. But we're certainly accounting for them so that reimbursement can occur. And the Office of Finance and Business Affairs is tracking all of that. So that is absolutely the intention, that they will either be returned if unused or there will be some sort of reimbursement process moving forward.
Okay, and it looks like we don't have any other questions for Rex right now.
Okay, I can hand it back to you, Laura. Thank you.
Thank you, Rex. Really appreciate that update. And then you can, sign off whenever you need to.
Well, I'll hang out for a few minutes in case any other questions pop up.
Okay, sounds great. With that, I wanted to run very quickly through the survey results from the faculty survey that we sent out about a week ago. This is preliminary. We still have some bits trickling in, and so you may see an updated version of this in the future, but I wanted to share what we had. We had about 192 faculty had completed it when we put this report together, and we asked a number of questions, if you recall. How satisfied are you on a scale of 1 to 5? 1 being not satisfied at all with the engagement of your students in the new teaching environment. And with that answer, we're not surprised to see that there are some concerns about student engagement, sort of middling concerns. No one, 13% is very concerned, and then concerned, but not as much so with that 46% and 29%. Next slide. We wanted to know how concerned you all are with student success in your courses. Now, of course, this question applies in any time period, but right now there's quite a bit of concern about that. 54% either showing a 3 or 4 on this answer, and then almost 20% very concerned. So we know that student success is a big worry, and we're working with Student Affairs to address this in a number of ways. And Student Affairs has been reaching out to the students that you are all unable to contact. Next slide. We knew this would probably elicit a response that looks like this. We asked about department budget issues. You know, how concerned are you with the following? And we are going to be going through our budget process at the central level. The Leadership Council met. That's the deans plus the president's cabinet, essentially. Went over all of the budget recommendations in the last few days. Those have been presentations, not yet discussions, and I think Glenn Nelson, our Vice President for Finance, is with us, and he can answer some questions about this. But clearly, there's concern at the department level, 64% reporting that they are quite concerned about this. Next slide. And then technological challenges in the distance environment. Actually, this is a lower response in terms of concern level than we expected to see. Actually, you know, there's quite a bit of concern, but then some of you are reporting that things are going just fine. Next slide. And then maintaining a research or service portfolio. That's a mix. So you can see here, it varies from not being concerned at all at almost 25% to being quite concerned at 22% there. But it's a mix, and that reflects really the differences in our programs campus-wide. And then I just broke it out here so you could see that those who responded that they had experienced positive, they had positive reactions. These are the areas that the positives cited as good experiences. And they were transitioned online. 37% of those responding positively said that that had gone well. ITRC, IT support. ITRC got big marks here. And certainly I will share that with Blake Beck. We got a lot of comments that ITRC is amazing, not to cut their budget, that they had really stepped up in this time period. And that was very heartening to see. ITRC does report to the Provost's office, so we've been working with them on these issues. Next slide. And then concerns. You can see wide variety of concerns here. Number one, cited as for those who had concerns was online teaching, 12% for budget. So budget and online, not surprisingly, are the big concerns out there right now for our faculty, but there are a bunch of other things in the mix here. Everything from loss of labs and clinics, which I am sure is had a high rate of response in College of Tech, to communication with students, to mental health and safety. I mean, all of these concerns came up in that survey. Next slide. So in order to address some of these concerns immediately, I wanted to make sure that we talked about a couple of things. I know that this is not as applicable for tenure, but certainly for promotion. It applies in the College of Tech across the board, and we are allowing an up to 2-year moratorium on tenure and promotion processes in the event that you are running into problems completing the goals that you had in that process. And that's a request that comes to the dean and then to the provost's office. Next slide. And then teaching evaluations. We know a lot of you have cited concerns about how we will handle the evaluation or analysis of teaching evals in this time period. And I sent a statement to the deans, and it's posted here on our website. You can see what that link is. That essentially says that special accommodation will be given when we look at teaching evaluations for the spring 2020 term. We really need to take into account the pretty dramatic transition we've had here and the impact of that on the teaching environment. And that means that we need deans and chairs and program directors to be judicious in managing the analysis of those evaluations for the purposes of promotion, tenure, and faculty evaluation. And that in cases where there are complaints about technology or complaints about how to use Zoom or complaints about the syllabus seemed very different after the transition to distance, that those would be discarded in that evaluation. Next slide. And this is the moment when I turn this over to your dean, in case he has anything he wants to add or clarify, and then we will take your questions.
Thank you, Laura. First, let me express my appreciation for your willingness to host this town hall meeting. I think, for one, I've enjoyed very much just seeing everyone's faces again. It's been a long time, so it's great to see you all. Great to have the great support that we've had from your office, Laura, and all the problems that we've run into. And I want everyone to know that Laura and Rex have supported us immensely in issues that have come forward. And even before COVID, Laura's been a great advocate, so we appreciate all that's happened from your office, Laura. I just want to take a minute because I want to leave plenty of time for questions today, but I first want to just express my deep appreciation to all of you for the tremendous, tremendous effort that you put forward to make everything go as smoothly as it has. We've had very, very few student issues that have come up, and we've just felt from students just this great outpouring of the tremendous efforts that faculty have made to make all of this work out. I know that probably many of you in my college probably couldn't spell Zoom or had ever done a Zoom conference before, and so for you to move all of the courses that you have over to Zoom and go all online has been a huge, heavy lift. We recognize that, and my hat's off to all of you for your tremendous efforts. I don't know about all of you, but I'm pretty tired of spending my day on Zoom. But having the opportunity to see faces and to be able to reconnect is a great thing. So I appreciate you all signing on today. I also want to say that those of you who have been doing these sorts of mini town hall meetings with your students, I think this is a tremendous thing, and I think students need the opportunity to be able to see your face and to have an opportunity on a regular basis to express issues that they may be having or appreciation or whatever they want to do with their fellow classmates and with their faculty. So I encourage all of you, if you haven't been doing this, to make that opportunity available to your students. Other than that, I just want you all to know that we're working feverishly on the budget. We've been spending a tremendous amount of time on Zoom conferences this week, putting budget presentations together and talking amongst one another about where we're headed and how we're going to make this tremendous holdback from the state work in the coming year. I want you to know that we have held harmless pretty much anything that will affect students to a great deal in our college. That's been our first issue, is that we wanted to make sure that whatever budget cuts we do make will provide opportunities for students to continue to have the great education that they've been getting in the College of Technology. Secondly, I will say that we've over the past several years have been working hard to have some open faculty lines and some opportunities to create new programs. Many of those open faculty lines we will be giving up in this budgetary process. So our second effort really has been to try to protect as many currently working faculty and staff as possible in this issue. And so I want you all to know that there'll be very few, if any, this first pass that are currently working at the college that will lose their jobs. So we feel very good about that. We feel good about the efforts that Michael has made to create a budget, as we've talked about it this last few weeks, that will go forward, that will really, I think, streamline things that are going on in the college and really put us in a position where we'll be better off in the long run. And we're excited about that. I want Michael to know how much I appreciate all of his efforts and time in working at home and preparing a budget and really providing all of the essential data that we've needed to make these important decisions. So good on you, Michael. We appreciate you a great deal. Anyway, that said, we'll have more budget information coming out in the next couple of weeks, and I want everybody to feel comfortable that we're going to keep moving forward. We look forward to getting back into the labs as soon as we possibly can. And hopefully that'll be sooner than later, and we can help students finish up those hands-on things that they need to get done to graduate and to be ready for fall semester. So we'll keep you apprised of all of that as it happens. Rex has really got a pretty good crystal ball. I've appreciated all the information that he's provided for us, and so we'll look forward to more of that and to decisions that will be made to let us get back into the labs. But I want you to know one thing for sure, and that is that paramount in our decision making is the health of faculty and students. And so as we make decisions that may be a little hard to swallow in terms of the dates we can get back in there, please know that we're making those decisions based on keeping people healthy. And the last thing we want to do is get a class back together in a lab and then have a bunch of folks catch the virus. So that's our number one thing that we're thinking about as we make these decisions. I wanted you all to know that. I appreciate all of you. I want you to know from the bottom of my heart how much I appreciate all of your efforts. I look forward to the time soon that we'll be back together and can enjoy one another's company face to face. So thank you, Laura, for giving me a few minutes to express those thoughts.
Thanks, Scott. And a couple of things I just want to reiterate that Scott said. One is that we have the health of all of you and our students at the forefront of our decision making, and also that we will do everything we can within the parameters of those health concerns to get you back into the labs. And that may be on a case-by-case basis, as Rex said. It may be, and some of that's already happened, but it may be working individually with you to make sure your lab environment meets health standards, but that you're still able to get back into that space. So we are really focused on those two goals in this college in particular. And with that, we'll take questions.
Okay, the first one is, what is the university's perspective on a student who contracts COVID-19 while completing their clinical education and has significant complications or even death? What about a student who potentially transmits COVID-19 to patients they come in contact with while on clinical education?
I know that we are dealing with this in the Division of Health Sciences as well. So I'm not sure if Rex is still with us, but if he is, I'm going to have him answer that question.
I think he had to run.
You might not have him, but I can tell you that what we're doing in those cases is working very closely with health districts and making sure that, and with the clinical placement site. Those sites, we don't have, fortunately, examples where we've had students who have been, who've died as a result of these clinical sites, but we have students who have come into contact, we know, and have been part of contact tracing. So that's really what the protocols are calling for. We're making sure that if they're in these sites, if we know that they've been exposed, that they're part of the contact contact tracing. We certainly want to manage the testing associated with that. So more testing, more contact tracing for students in these environments as we go forward in particular. We expect that to be the case. And providing all of the support that the institution can to make sure that they get the health care that they need, and also that they have the support around that health care. Student Affairs is very committed to making sure that our students as a whole have those options, counseling, for example, and then that they understand what their health care options are in addition to that.
Laura, will the discussion of Stop the Clock also include concerns about state board reviews / delays of promotion bonuses for faculty approved for promotion this year? And then what about all the comments about how I didn't sign up to take an online course?
So those comments on the teaching evals, I assume, is what that refers to, that latter point. Certainly, our students didn't sign up for an online course, and they're in one anyway. So that's not going to impact the outcome of those evaluations. That's a campus-wide issue. Some of our students like it. Some of our students really don't like it. So it's a mix, but it won't count against that instructor's teaching evaluation. Yeah, the other part of that question was, what was, Jenny, can you repeat that?
Absolutely. So will the discussion of Stop the Clock also include concerns about state board reviews / delays of promotion bonuses for faculty approved for promotion this year?
Well, the process for approval of tenure and promotion is under the jurisdiction of the institution. And so the president and I have signed off on those for this year, the recommendations for this year, and those letters have gone out. So some of you received your promotion or tenure support letter from us. Those are done. Those appointments have happened. Those rank changes will occur. In terms of the increases, the financial increases that go along with those, traditionally, those are currently all of the institutions that have a tenure and promotion process at the state level have requested, and I think Glenn can speak to where we are with this, have requested state board support in asking the state to process those, because they are falling under the state's personnel review process. We anticipate a positive result. The state board's managing that on our behalf, the state board office, and we anticipate a positive outcome that we will hear about in just a matter of days. Glenn, if that's not accurate.
Accurate.
Me.
Accurate.
That's great. So essentially, these are two different things. We are not going to hold rank changes while we wait for the state to approve that process, if that makes sense.
Is there a process on how anyone would be addressing testing concerns with students with a testing accommodation or proctored testing?
Yes, and so that's managed by Student Affairs. We can certainly provide contacts for Student Affairs for those students who are concerned about accommodation in the current testing environment. I would suggest reaching out to counseling and testing, and they can work through that with a student, or the ADA office, which has also been working with students on those types of accommodation concerns.
Okay, and related, has anyone addressed concerns with students or staff that may not have the technology options on how we can reach out to the students to teach them?
So this is a concern about the faculty member not having the
has anyone addressed concerns with students or staff that may not have the technology options on how we can reach out to students? So
yeah.
Both.
Go ahead. Was that Glenn?
No, I didn't say anything.
Yes, IT has been managing those processes for faculty, but also for students. We have, as you know, probably parking lots for Wi-Fi, for student Wi-Fi access. And then there is also a process by which a student can receive the hardware they need in addition to that Wi-Fi connection. But my suggestion is reaching out to either the help desk or to ITRC to ITRC has been handling that for the academic affairs office. In those cases where you either don't have the technology you need to teach, or you're encountering students that don't have it.
I have heard that some people are going into the College of Technology and working in their offices. Is this something we can do if we will be alone and we feel safe?
If you are a faculty member and you are doing that in order to teach your class for that hour because your Zoom connection is unstable at home, or you have to come into your office to get something for teaching, then yes, absolutely. We've said faculty members can come into their offices and remotely teach their course. They can pick up materials that they need, and they can, if they need to grade, and they need an hour away from their family to get that grading completed and posted in an online environment, then that's absolutely fine as well. We are discouraging long periods of time in the office for any person, and no research activity or long lab time unless otherwise approved through the dean's office. So hopefully that helps to answer that question. We do have faculty coming in sort of a limited way. We want to make sure everybody maintains that social distancing requirement, that you wear a mask when you're in public, that you don't congregate, don't have lunch with your colleagues in the seminar room, for example, those kinds of things.
Laura, can I add a piece to this? So one of the other things we have to think about is we have had, even though custodial is still working, we have a limited custodial staff. They've cut back. Our buildings are closed to the public. And anytime a person comes in and uses the building, if they use the restroom facilities, we need to make sure that those are clean and sanitized. And so we're trying to discourage people from coming in other than for those reasons that Laura just stated.
Okay. Next question. BSU has done furloughs. Will we see some here at ISU?
I'm going to let Glenn answer that question.
I was just looking at your picture on the on the big board to see, and Scott's just smiling, seeing who's going to answer this one. Actually, serious question. The first thing about Boise's furlough program is they're responding to some significant revenue losses and shortfalls in the current fiscal year. And so they're actually requiring people to take a significant number of furlough days before July 1, in addition to a furlough program next year. Each of our institutions in Idaho have a different financial basis or footing and financial challenges and financial resources. So I don't think you'll necessarily see furlough plans across the four colleges or universities being identical. That being said, we do have a significant budget deficit that, as Scott said earlier, we've been working on this week. But then we also have challenges associated with the pandemic, fiscal challenges associated with the pandemic. We have not yet formed a furlough plan, but the president did share with Leadership Council today that we will probably be having discussions, as that's one of a number of things we can do to help close the gap. But specifically at this point, there is not a furlough plan that has been debated, and Boise is on a different trajectory than we are. Boise State, not the state government.
Thanks, Glenn.
Okay, next question. When the lockdown happened, labs were closed. When will we be able to make up those labs?
Well, that is, of course, the big question that we all have campus-wide. When will this be over, essentially? And Rex, I think, answered a piece of that when he gave us the overview on where we are in terms of the health environment. At this point, we anticipate once the stay-at-home orders expire, and as you know, Idaho's is set to expire on the 30th of April. We'll hear from the governor's office, I believe maybe as early as tomorrow, about what the ongoing plan will be after that, or if that order will be extended. Until we have more information about where we are in terms of the state trajectory for cases, we had a slight bump in COVID cases in the last couple of days statewide. Until we have a better sense of where we are in terms of that trajectory, it's very difficult to say which day or which week even we'll be able to go back to semi-normal operations. As Rex mentioned, they probably won't, we're not just going to environment. All are facing. We will do everything we can once we understand those parameters, and we expect a phased in situation. Once we understand that, we will do everything we can to get you back into your labs safely with social distancing requirements in place, and so that the students can complete those sections. That's one of our top goals in academic affairs, and I'm committed to working with you on an individual basis, program by program, to make that happen. I'm sorry I can't give you a more direct answer. I'm sorry I can't say, well, on June 1, we can all be back in the labs. That would be fabulous. And some of you know I'm a planner, and so this is making me crazy, honestly. I've got the fall schedule locked down, as some of you may know, because I don't want to make a bunch of changes to it right now. We have too many variables, and we will probably keep changing it. I know that what we have out there for fall is not what we will actually be doing, but we should know more in the next week or so regarding a little bit more information about the phased in approach that we expect to see. So we will be communicating that as soon as we have that information.
Next question. Given that faculty is very stressed and experience a lot of trauma given this current situation with teaching, how will this be taken into account with evaluations beyond technology type issues?
I think we all in administration, chairs, program directors, deans, certainly the provost's office, need to be cognizant that this is not a normal time, that these evaluations will be reflective of the trauma that our students are experiencing as well, that there are going to be cases where they aim that at the instructor when it's not in any way the instructor's doing. This is a much more difficult time than we've experienced collectively as a culture in any of our lifetimes, and that has to be taken into account in these teaching evaluations. It just simply does. And we may be in a situation where we're not going to even use these evaluations for the purposes of evaluating a faculty member's performance over a 5-year period, because that's usually how we're using them, is over a 3 or 5 year period. And we hope that this semester is an anomaly and that we can just treat it that way.
Is there a possibility of the State Board of Education or ISU declaring financial exigency in the light of pullbacks or possible economic recession caused by COVID?
I'm going to have Glenn answer that, but I can tell you that has not been a conversation that has happened at Admin Council around this situation. But I'll let Glenn answer that.
Yeah, financial exigency is when you can't pay your bills. It's when we can't make payroll. We can't make the next payroll or 2 payrolls or 3 payrolls out. We have significant reserves at this university. We've been blessed with that. In some ways, it may be a curse in that they could be looked at as we don't need help because we have that. So financial exigency is not even on the table for discussion at this point in time. And I would not see that in the foreseeable future.
Okay. Are we better prepared as a campus for a future outbreak now? Is there a plan in place, or are we really just trying to get through the crisis and plan to address this when things get a little bit more normal?
They're actually, the answer to that is yes to both. Are we more prepared now? Definitely. I think the whole nation is more prepared. I think the world is more prepared. I mean, pandemic planning is something that no one really wants to do when it seems like an impossible thing to have happen. And honestly, the type of pandemic that we're in now, it only happens about every 100 years. So it's very difficult to, as we know, to invest a lot of funding into something that may or may not happen in the next 50 years. That said, we are more prepared as a campus, we're more prepared as a state, and we will use that preparation to manage this crisis going forward, whatever that looks like. And then, I think in terms of the types of preparedness that we'll need to have after this initial crisis. Are we planning for the crisis or are we planning for the future? We're doing both. We still have to get through the emergency management of day-to-day tactics. In some ways, that's the difference between, planning the tactical attack that we're in now and, what do we do to recover? We have to do both of those types of planning. We're shifting now to from the tactics, which has really been a day-to-day, try to catch your breath and get caught up kind of effort, to that recovery effort where we are looking, what is this going to look like 3 months from now? What do we need to do to prepare for that? What does it look like 6 months from now? And that's what the group that Rex Forrest mentioned that he is chairing is doing. They're looking at what are we going to need in 3 months as a campus to address the needs of our faculty and students in a phased-in environment. 6 months from now, let's hope that we don't ever have to think about this again, but the chances are we might, and so we have to plan for that. And really what we're looking at is a 2-year plan, and thinking that for 2 years we will have planning around this effort, and then hopefully, we can go about our lives and everything again. But that is the current plan mechanism. Plan for today, and then plan for 3, 6, and 2 years out.
Laura, you broke up just a little bit. You said that's the current plan, and what was the last part of that statement?
I'm sorry. I am sharing my Wi-Fi with a teenage boy, and I would go get him off of his game in the basement if it was appropriate for me to leave this meeting, but I'll just stop my video for now. Really the planning is that we're planning for the short term, we're planning for today, but we're also planning for 3, 6, and 2 years out.
Great, thank you. Next question, if and when the governor lifts the stay-at-home order, will faculty be allowed back on campus for meetings with correct distancing, working for more than short periods of time? Basically, can we go back to work?
Yes, we anticipate that once the governor lifts that stay-at-home order, and that we have guidance from the Center for Disease Control and also from our health districts, that we will be able to get back to work utilizing whatever social distancing protocols are in place or recommended, and that we can phase in, using a phased-in approach to do that.
Great. Next question. Do we have a plan for virtual commencement / convocation? I know a lot of our students will be getting careers after completion of their degrees and may not be able to attend a future commencement.
I know that the Office of Marketing and Communications is working on a number of events, virtual events associated with celebrating our current graduates for May, and then also looking at alternatives in the future. Some virtual on that list, but also a face-to-face commencement potentially. And Ginny has just shared a link that will cover that information.
That's right, Laura. We, our office is working to speak very closely with our graduates and work with them as we move forward to inviting them back for December's commencement. And then we're also working as a collective campus to figure out what each of the individual colleges are doing to celebrate their graduates. And if you speak with your marketing team at the College of Tech, they can tell you more about what is being planned for your students specifically. And if you have any questions about the rest of the university, you can absolutely reach out to me and I can connect you with our event planner, Allison Johnson.
And Scott, you might, the College of Tech is doing, I know the actual event on the list.
Yes, is Courtney on with us today? Courtney and her team have come up with some really phenomenal ideas about some things we can do to celebrate our graduates, and I'm not sure where we're at in terms of the approval process with marketing as of yet, but we have some really great ideas and we'll be getting those out to you soon as we know that they've been approved.
Great. I know our office was collecting all of that information early this week and late last week, so hopefully some more information will be forthcoming. Next question, do you expect the program prioritization process ISU went through in recent years to be used as part of the budget reconciliation process?
Well, the process that we went through a few years ago has been completed. We are launching a new process with Faculty Senate recommendations on program metrics. Your senators have been involved in that. That actually goes to the Senate in their next meeting. Those recommendations will go to my office, and then we will utilize those from those recommendations from the Faculty Senate to create a new program prioritization process that will be consistent with what the state board is requiring us to do, which will start in May and conclude in December of 2020 or January of 2021. This will be an iterative process that will involve the college, that will involve all of the program directors, all of the programs in terms of how you manage the reports about your own programs. We do think that that process will ultimately align with a new budget process, which is also happening in a parallel way, and Glenn may want to speak to that, but we plan to link these processes. But right now we're launching a new program prioritization process, so the current budget recommendations don't reflect that.
I think you've captured that.
Okay, how are the fall enrollment figures looking?
Well, that's another one of the questions that we are really anxious to answer. We do have an issue in terms of timing. So we had a different timing for students to register this year due to not having an early registration event for freshmen. So freshmen are registering later. That means that we have fewer freshmen registered than we did at this time last year, but it's not an apples to apples time comparison. We do know that Student Affairs sent out a student survey last week, and 72% of the respondents indicated that they were definitely probably returning to ISU in the fall. So those were continuing students. That's good news. And then also we know that our admissions numbers are significantly up. What was the percentage they were up? Lyle, do you remember? It's significant.
I think Stacy reported it as 140% this morning over last year, same time.
Yep.
Yeah, so we are seeing really great admission numbers, and we just hope that that translates into the fall enrollment data. And we're in an uncertain environment, so we're working with students, but we think that we're going to see some increases in some categories of students who are planning on leaving the state who have decided to stay at home.
Next question, if our students are receiving incompletes and spring extension to complete labs, will they not be attending spring graduation that they registered for?
So would they graduate in the spring, even if they get an incomplete? It depends on the circumstances of that individual student and that individual section. If these are courses that are utilizing the term extension, and we sent out an additional email about that today to the deans, then they would graduate in the spring. If they are receiving an incomplete that doesn't complete, it depends on the incomplete contract as well. If the incomplete does not complete until a future term, then they would graduate in that future term.
Can you tell us specifically what is happening with the BASS department chair search?
I think that is a question for Scott.
Yes, we were able to get permission from the state just recently to move forward with that search, so we will be moving forward. We will probably name an interim when Tina leaves this week to sort of get us through the rest of this fiscal year, and then hopefully we can have someone hired and ready to go by August.
Thanks, Scott. If a student wants to drop a program until this is over, will they be penalized, or will they be able to rejoin the program where they were?
So I'm interpreting that as they're dropping out of the entire program and that probably applies to programs that it's not an option. You're either in the program or you're not. And we are going to work with those students. If they are having to drop out now because of COVID related issues, we're going to work with those students to get them back in and to ensure that they're not paying penalties to that. And some of those processes I know Student Affairs is working out. And then there will be support for students through the CARES Act as well. And some of that's been is in process as well.
Okay. And Laura, that's the end of our list of questions.
Well, I know that you all have other work to do and other Zoom calls to take, but I just wanted you to know what a pleasure it has been to get to see you all. It's just really nice to see your faces and to know that that we are all out there together in this. And I want to convey again the support from the Provost's office. We are available if you have specific concerns or questions that I can answer. Also working very closely with Scott. Scott and I have been in steady contact about your programs and about the challenges that you all have. So I want you to know that I'm aware of what's happening and doing everything possible to support you in this difficult time. And that's it from us. Great. Thank you for joining us. It was great to see you all and really appreciate the questions and the participation. We will have another town hall. We will have another group of town halls probably in May after we are done with the budget process and when we know more about what our back to work plan will look like. But thank you all. Great to see you.